Do you give verbal permission to participate as a model in this assessment and be recorded for school purposes for Aspen University Class N495?
Yes.
This assessment is intended to show my skills with the assessment actions only and is not to be used as direction for your health status or follow up with any irregular findings. Do you understand this?
Yes.
Okay. My name is Wendy Heater. Washing my hands. Can you please tell me your name, full name?
Zane Bagley.
Can you spell your last name for me?
Bagley.
Okay. Birthday?
7/7/56.
Okay. What year is it now?
2019.
Who's our president?
Trump.
And what day of the week is it?
Wednesday.
Okay.
Had to think.
All right. My name is Wendy Heater. I'm going to be conducting your assessment today. Okay. So first we're going to take your temperature. .7. Okay, pulse. .73. Okay. Stick this on. We're going to check your pulse ox. Okay. 95. Okay. Now I do not have the instruments to do a blood pressure, but I would do it on the arm, wrap the cuff around, listen for a pulse here, pump it up until I did not hear a pulse any longer, deflate the cuff, then go 20 over whenever I heard the pulse. Take it from that point. All right, your pain level on a scale of 1 to 10, with 10 being the most excruciating pain, what is your pain level right now?
2.
2? Okay, where's your pain is at?
In my neck.
Neck? Okay. All right, we're gonna assess your face and neck. Okay, everything looks symmetrical. Okay, we're going to feel for arteries on this side. Okay. Strong, strong. And felt on both sides equally. Okay, we're gonna feel for TMJ. Open your mouth. No clicking. Okay, and then your thyroid is here, so let's feel for swelling of the thyroid or enlargement. No enlargement of the thyroid. Okay, and everything is in midline with that. Okay, I want you to clench your jaw down for me. Smile and clench your jaw down. Okay. And then smile. Raise your eyebrows. Okay, perfect. All right. Say light, tight, dynamite.
Light, tight, dynamite.
Perfect. All right, now we're going to palpate the lymph nodes. So we're going to start here. Work our way back here. Down the neck. Nothing felt. Where is your clavicle? Feel right in here. Okay, nothing is felt in that either. Okay. So, that is done. Okay, let me check your skin turgor now. A little bit dehydrated. You need to drink more water. A little bit dehydrated. Cap refill. Press on the fingernail bed. Less than 1 second. And check your ankles for edema. no edema on that leg. Sorry. And no edema present on this ankle either. Okay. All right. So we're going to cover one eye for me with your hand. Okay. Follow my popsicle stick. Okay. Cover the other eye. Do the same thing. Okay. All right. Now we're gonna, I do not have a pen light, so I do have a flashlight that I'm gonna use. So I want you to stare at the wall over here, and we're gonna check to see if we get the twinkle in both eyes here. And it is visual in both eyes. Okay. Now, just look straight ahead. Okay, pupil react. Okay, I do not have an otoscope to look into the ear canal with, but what I would do would be hold to the ear, pull up, insert the otoscope at that point, and then assess the inner ear to see if there is any infection or any coloration variance that's not normal. All right, so let's look at your mouth and your throat. So let me know if any of these areas are tender. We're going to look at your sinuses. Any tenderness up in here?
No.
How about in here?
No.
Okay. All right, I need you to stick out your tongue. Stick out your tongue and say ah. Okay, uvula is in midline. No infection. No redness, no irritation. And that was for the glossopharyngeal. All right, now we're going to look at your thorax. So if you could please remove your shirt. Okay. Is there any way to turn around on the chair so I can look at your back?
Yeah.
Remove this. Okay. Okay. So sit up nice and straight. Spine is nice and straight. Okay. Take deep breath in and out. Everything moves in motion together. One more time. Okay. Now, say 99.
99.
99.
99.
Again.
99.
And again.
99.
Okay. That sounds good too. And I'm going to listen to see if we hear any breath sounds. Our breath sounds are good. Take a deep breath in and out. Again. And out. Breath sounds heard bilaterally, no signs of wheezing, rhonchi, or crackles. All right, and then if you want to turn around, face the other way. Okay, we're going to listen again, but this time we're going to listen to your carotids. No sign of any bruise associated with the carotids. Okay, now we're going to listen to your breath sounds in the front. Okay. Deep breath in. Deep breath in. No wheezing in the neck. Okay. Okay. Breath sounds are clear in the front as well. All right. Now I'm going to listen to the heart sounds, listen to all the valves, and see if we have any heart murmurs. Okay, so we'll start up here. Sounds good. Patient does have an S2 heart murmur. All right, so let's inspect your abdomen at this point. What we're gonna do is we're gonna look at any abnormalities with the abdomen, and there is a bulging at the belly button right here. And we're gonna listen to see if we have bowel sounds in all 4 quadrants. Bowel sounds are heard in all 4 quadrants. All right, and any tenderness. Let me know if you have any tenderness.
No.
Nothing?
No.
Okay. All right, now we're gonna look at your extremities, and we're gonna look at all of your joints, and we're gonna inspect and palpate your joints. So let's look at your wrists. Okay, turn them. Okay. Okay, turn your wrists. Okay. And raise up on your shoulders. Okay. And your knees. Kick your leg out. Okay. Kick that leg out. Okay. And your ankle. Can you flex your toes up and down and point? Okay. Same with this one. Up and down. Okay, good. All right. Now on the toes, there is discoloration on the toenail bed, and it would not be a good source to use for capillary refill of the feet. Now, let's do grip, so cross your hands this way. Okay, squeeze. Okay, bilateral grip strength is present on both hands. Okay, and let's look at your pulses on your legs as well. Okay. Present. Okay. Pulses felt bilaterally and are all present. Okay, now what I want you to do is stand up, and we're going to assess your gait. So what I want you to do is walk heel to toe, take a few steps and walk heel to toe. Okay, perfect, and then come back. Okay, now we're going to check your balance. So turn around, close your eyes. I'm going to nudge you just a little bit to see if you can maintain your balance. Good, very good. Okay, so we're going to assess your reflexes now so you can sit back down. I do not have a hammer to be able to assess these reflexes, but what I would do would be on this one, you would aim for about this area right under the point where you can feel, and then that will assess the lower extremity at this point. And then you can also use the Achilles tendon down in here, back behind the foot as well to get the lower extremity. With the arm, to get the upper extremity, you would hold it out like this, and then your hammer would hit about right here, and then you would see the arm show its reflex as well. All right, and then the last test we're gonna do is the Cerebellar Test. So I want you to go like this with each hand. Okay, and then do this. Okay, now take your hands and go like this, make circles. Okay, and then on your knees, go like this. As fast as you can. Good. Very good. And then that concludes our assessment.